Okay, so it's day 7 of Ellen's keynotes study streak, and I hope you are enjoying and learning and also enriching your knowledge of Materia Medica through the very basic, book which is Ellen's keynotes. So, hello, Dr. Parul. Glad to see you here. And there are few on YouTube and few on Instagram as well. So, I hope you all are enjoying and you all are learning uh, the Ellen's keynotes study streak. It's in continuation of 7 days, and we'll go further like this bef- till the end of the entire Ellen's keynotes that we'll finish, because this is one of the important book which we should kind of memorize. So it's day 7, and let's go further in studying one interesting remedy. So today I'll cover just one remedy. I had planned to cover two or three remedies, but I'm just covering one remedy. The reason is that uh, when you have attended all the past sessions, when you have heard and studied again from the Allen's keynotes about abrotenum, about ethusa, about borax, about calcarea carb, about natrums, about sulfur, etc., etc. You and graphitis and petroleum, of course. So these are the remedies we covered. When you have learned and studied all these remedies and some other more remedies which I have yet not covered, but a few more like chamomilla, senna, tuberculinum. Uh, the combination of all these remedies is present in another remedy. So how will you understand that? Through the comparison and differentiation and studying the materia medica. And how will you memorize this? The question from Dr. Parul: you have to read, reread, 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 keep on memorizing, keep on seeing patients, keep on seeing people around, their behaviors around. Then you will be able to memorize and understand who behaves, how they behave, who behaves, why they behave like this, how they behave, and there are many things you can do. Physically you can see them, physical problems you can understand what they are suffering, why they are adopting certain position, etc., etc. So I was at this point where this combination of all these remedies, you see, the remedies that we discussed so far in all these 6 days, and some smaller remedies that we'll cover in future, and a bigger remedy, tuberculinum. The combination of all these remedies we have in one remedy. Can anyone tell what the remedy is? So it's a very interesting. Good evening, Dr. Chandrasekhar. Glad to see you. So now the usual suspects and usual materia medica learners are joining, and I hope it's getting interesting because it's just day 7, and we have a lot more to cover, like more than 100 or 150 remedies more to cover. So the one remedy which I think it's beyond understanding of a normal beginner student, because I was myself confused when I saw this patient, and then I saw that I was giving some remedies one after the other without getting any result, and then I saw this interesting remedy which had the combination of abrotenum, ethusa, borax, some elements, some symptoms, calcarea carb, silica, sulfur, natrum, petroleum, graphitis, chamomilla, senna, tuberculinum, etc., etc. So the remedy that we'll discuss today is an interesting remedy known as sanicula. Okay. The very first line that is mentioned in Ellen's keynotes is dread of downward motion, just like borax. Child is headstrong, obstinate, cries and kicks, cross, irritable, quickly alternates with laughter, does not want to be touched. We saw already this was present in anti-group. In future, when we will study Sina, we will see the same thing. He is constantly changing his occupation. Now, what does this mean? This means that it is not the only remedy for uh, children, but it is also a remedy for people who are in their adolescence or who have crossed adolescence and they are looking for work or something to be occupied about. So it can be something that is for children, also for teenage and adults who are constantly changing and not steady on one thing or one object. They want to, kind of be changeable in nature. So if you have your ears open today in this session and your eyes open in your clinics when you attend this patient, by observing them, also by listening to them and what they are doing, how they are doing, and what phase of life they are and what have they been through, you will not miss this interesting remedy which is known as sanicula. So the next line which is mentioned in Ellen's keynotes is symptoms constantly changing, just like lichen and pulsatilla. So this remedy will always have this kind of changeability, and you will see this changeability in young population. It can be children, it can be teenagers, it can be adults, it can be kind of that age group which you will find. So, Dr. Chandrasekhar, you are very correct. You are there on with us on YouTube. So, you have mentioned impatience. So, it is kind of an impatience, but it is by its innate nature, that inner nature, that it wants to keep on changing because he does not like to be in one place. Impatience will also have an element of not being able to satisfy oneself with one thing. So that is there. Going further, we have foot sweat between the toes, making them sore, offensive, just like graphitis, sorinum, and silica. On the and there is foot sweat on the, and there is offensiveness on the soles, as if he had stepped in cold water. Child kicks off covering or clothing even in the coldest weather. Heparin and sulfur are given as the next remedies. Emaciation progressive. Now, what does this line mean? You can speak a kind of a paragraph on this. This is how Kent could speak a lot about a certain word from uh, one word or one observation. So when we see this emaciation progressive, you see a patient who is weighing around 10 kgs. The next month or the next follow-up he comes, he is 9 kgs. The next time you see he is eight and a half or just around between 8 and 9. So there is a progressive emaciation. It may not necessarily mean that they are getting lean thin or they are totally emaciated. It can also mean that they are losing weight or they are not putting on weight. So child looks old, dirty, greasy, and brownish, and skin about the neck is wrinkled and hangs in folds. So the other remedies which we have studied, the one of the remedies was abrotanum. Natramid is another remedy which is mentioned by Ellen. Iodum and sarsaparilla we are yet to study. These are mentioned in the bracket. So if you remember them, when we cover those remedies, you will be able to collect that we had read about this remedy, so and so symptom in so and so remedy. And that is how with Allen's keynotes and comparison, comparing the different remedies, we will be able to achieve the differentiation of different remedies. So, Dr. Priyanka Madan, you are, very correct. It's kind of a discontentment, it's kind of an impatience. All these elements bring together this element of changeability. So, going further, there is one interesting symptom which is head and neck of the children sweat profusely during sleep, and he wets the pillow far around, just like calcarea, carb, and silica. The only difference is that the smell over here is very peculiar. We'll come to it very soon when we go further. And there is a profuse scaly dandruff on the eyes, eyebrows, in the beard. So when you read these symptoms, you see that it's not only mentioned that it's the remedy for children or toddlers or growing age of population, but it's mentioned that there is profuse scaly dandruff in the beard as well. So you'll have these adolescent children worried about their dandruff, worried about how they will overcome their skin issues. Sanicula is one of the remedies. They keep on changing uh, professions. They keep on changing whatever job they are doing. They have some skin issues. Think about Sanicula. Okay, soreness behind the ears with discharge of the white and gray viscid fluid, just like graphitis and sorinum. So, behind the ears complaints, there are few specific remedies, especially they work on the folds. Sanicula is one of them. Graphitis and sorinum are one of them. Don't forget to give them in your cases when you see them. Tongue is large, flabby, burning, must protrude to keep it cool. This is a very strange symptom you may encounter or you may not encounter, but you can keep in mind and be ready to prescribe whenever you see it. And if there is ringworm on the tongue, think about natramine. Very rarely you will see that. Going further, we see nausea and vomiting from car or carriage riding. We saw this yesterday or 2 days back in, petroleum, and we also have the other remedies which is cocculus. So sanicula is one of the remedies most underused, most under prescribed. You can think of these remedies provided the other symptoms match of the nature of the behavior or the sweating, etc., etc. There may be in thirst, which is drinks little and often, just like arsenic and phosphorus, and is vomited as soon as it reaches the stomach. Now, again, you have this symptom coming from arsenic and phosphorus. So, it's a kind of a combination of different remedies brought together and served to you on your plate, and you have to pick up the remedy from your knowledge of materia medica. Incontinence of urine and feces, sphincter unreliable, just like allosocotrina. Urging from flatus must cross legs to prevent feces escaping. Constipation, no desire until a large accumulation. After great straining, stool partially expelled, partially recedes, just like silica. And if this is the case which aggravates the complaints, then the remedy is thuja. Large evacuation of small dry gray balls must be removed mechanically, similar to selenium. So you have these patients who, children especially, who cannot clear their bowels at once when they are in their phase of, you know, training to use the toilet and get rid of the diapers. Sanicula can be one of the remedies. Magmure can be another remedy where there is, stool which is partially expelled but partially recedes back because they fear that, they are not normally used to doing this kind of bowel excretion. And that is where Sanicula can be taught. The next sentence mentions Magmure also. Let us see. Stool hard, impossible to evacuate, of grayish white balls like burnt lime, crumbling from the verge of anus like Magmure, with the odor of Limburger cheese. Now, if you are a good, uh, you know, you have a good vocabulary, you have good knowledge of the dictionary, the different words which are present, you will understand, and the different, things that are available and seen in the environment, you will understand that what cheese smells like and what a cheese which is kept for few weeks and few months smells like. So it's kind of a smelly like gym socks, or very 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 strong and foul smelling. So it can be, the stools can smell like this. The same applies to their perspiration as well. So you'll see the traits of sorinum everywhere through the remedy in sanicula. The only difference is, these little things which we are discussing. Diarrhea, which is changeable in nature or character and color like scrambled eggs. Frothy grass green turns green on standing like scum on a frog pond. After eating, must hurry from the table. So you have this remedy which is, showing you exhibiting symptoms like sulfur or allosocotrina, and they rush to stools to pass the stools immediately after or while eating. Go for sanicula. So someone named as Twinkle's Homeopathy, you are mentioning that sanicula is silica like with large stools. Yes, probably you are right, and it can also have changeable stools. The odor of stool follows despite bathing. The remedy in comparison is sulfur over here. And in going further, we see leucorrhea with strong odor of fish brine oozing from the rectum, smelling like herring brine gives you the remedy calcarea carb. And if it is fish brine, there is a very little difference. It's almost similar. What does fish brine mean? If you go to sea, if you see those fishermen who have picked up the fish, fresh from their nets, you will, if you smell them, you will understand what does a fish brine, which is fish from the salt water, smell like. And that's where you can think of prescribing sanicula if the patients complain of those type of odor in their leukorrhea. Or else, if there is discharge from the ear which smells like fish brine, think of the remedy tellurium. Weakness, bearing down contents in the as if the contents of the pelvis would escape, aggravated by walking, misstep or jar, better by rest or lying down, desire to support parts by placing hands against the vulva. And this is similar to lilium tigrinum and murex. Soreness of uterus. So there will be a class of patient who will have prolapse or prolapse like symptoms going towards prolapse. You can think of sanicula if the other physical generals and particulars agree. Burning of the soles of feet, must uncover or put them in a cool place. We saw this in sulfur. We saw this in, it's there in medorinum also. It was mentioned in sulfur. It is also there in lachesis and sanicula. In fact, I have annotated another remedy which is chamomilla for this type of symptom. Maybe I have cured it or I must have seen it read somewhere. So in this way, you can make your own collection. You can note it down in your Allen's keynotes or your book wherever you are reading from, and keep them in mind so that whenever you read in future, maybe 1 year down the line, 2 years down the line, 5 years down the line, 10 years down the line, I must be reading this. I don't know, maybe 100 or 150th time. So you need to keep on reading, rereading, rereading, so that you are, kind of in tune with the symptoms, and they exhibit to you in front of your clinics. Excoriation of skin about the anus. Sulfur is the remedy which is mentioned, covering perineum and extending to genitals. These patients who have jock itch and tinea cruris, we discussed about them few days ago. So these patients will, have so much scratching and so much itching that the skin will kind of peel off from those areas, or it's so violent itching. Think of sanicula as the remedy. You may need to give 2 3 remedies in succession. Don't stick to one remedy. What we can do in such cases is outside the discussion today, but this is my small tip for the day. And in the relations, you see the mention of abrotanum, alumina, borax, calcarea carb, graphitis, nitromus, silica, and other great antisorics. So sanicula is a combination of all these remedies. Now, just to give you a bonus, and since you are all glued to this session, and I want you all to also experience what was my failure and how you can overcome this step. So this is in from a case about 10 years back from 2014, and how I kind of couldn't come to sanicula, but I was hitting the other remedies around, and then I thought of sanicula. So I had posted this long back. This is like 10 years ago on many social media platforms, but I'm bringing it out again to help you all understand, and this is how it kind of helps you rejuvenate and refresh your memory. So it's a case of 3-year-old girl. Now she must be almost 14 or 15 years old, and she had constant loose stools. The parents were worried that the child is not passing formed stools, and we are very much worried. It was changing every day. Sometimes it was hard, sometimes it was soft, sometimes it used to be green, sometimes it used to be brown, sometimes yellow. And I had changed many remedies. I'm coming to it. There was also involuntary urination, which the parents were worried about. And one of the very important thing was that the child was not able to tell whether she had the desire to pass the urine or stool, and the parents you had to remind the child again and again. And another thing was there, uh, she also had pain in the abdomen before the stools, and also on waking in the morning and afternoon. So you have this symptom very predominantly present in lycopodium and many other remedies. It's a very big symptom. But the other key mental symptom which I found was that there was irritability. Child used to get irritable about not getting some play stuff or not getting a thing which she was demanding. And as soon as she used to get it, she used to become playful, get occupied in her some whatever plaything she used to get, or whatever diversion used to happen to her by the parents or by the cousins that were there around. And what used to happen was that this phase used to keep coming after every few minutes. There was irritability, there was playfulness, there was irritability, there was playfulness. So you see this kind of an alternating action. And on the mind level also, she was very much changeable. I had almost given pulsatilla, I had almost given, for this irritability, chamomilla. I had also given her sina tuberculinum, but she was not, getting better, not getting anywhere, but close to better also. And she kept on changing objects, playthings, etc., etc. And perspiration was especially on the parts where she used to lie down. Now, I gave her chamomilla. This is what I mentioned everywhere, and this is a very well documented cases way from 10 years back. And I had given the patient chamomilla, tuberculinum, antim crude, and it only helped for some time and it got stagnant. Now I needed a remedy. This was my thought when I was, very, uh, early in my practice, and it was just 4 5 years of my practice. So I thought that if I study the nature of the patient, I will need a remedy which is having the irritation of chamomilla, repulsion of sina, and changeability of tuberculinum. And that, my dear friends, is present in sanicula. So when I repertorize this case using few rubrics, which is obstinate with weeping, irritability alternating with playfulness, only remedy sanicula, change desire for pain, abdomen, waking on, only this rubric was not covered with sanicula, but all the other rubrics were covered by sanicula. There was slimy mucus, stools, changeable stools, involuntary urination, thirstlessness as a broader rubric, and perspiration on parts lain on, which has 12 remedies. This was from Complete Repertory 2013. And the only remedy which covers through and through all across in all the rubrics except one which I discussed was sanicula. So you have this kind of, N.M. Chaudhary also mentions that it bears a great resemblance to natrum silica, calcarea carb, graphitis, borax, and I prescribed sanicula and the results were marvelous. So when you have such a case which is a combination of few remedies, think about sanicula as one of the top remedies. It is very much neglected, it is very much underused, underprescribed, especially when you don't know how to prescribe, when to prescribe. And then I mentioned a few interesting rubrics which are not to be discussed right now because we are discussing just the Allen's keynotes. But just to tell you that it has the aversion of intim crude, it has the irritability of chamomilla, it has the repulsiveness of sina, and the change desire of for from tuberculinum. So if you find these combinations and the other symptoms, and or the other symptoms, it can't be always that you will find these parameters. You may find some other components. Focus on the prescription pointers and think about sanicula as a remedy. So I hope it was a enlightening session. It was helping you all to understand what we should do, how we should do in our practice, and we'll cover a few remedies tomorrow in in the same session on Ellen's keynotes study streak tomorrow 6 p.m. So if there are any questions, please feel free to ask, and we take a break for now till tomorrow evening. Okay, so that's it from me, and stay inspired and